Hello everyone, you're very welcome to this Innovation and Change in Mental Health Services Part 1 webinar. Delighted to have you here on what is actually turning out to be quite a nice day here in the Midwest. My name is Margaret Keane and I am Education, Training and Development Officer here at Mid West ARIES. For those who haven't attended any of our webinars or workshops, we're an inclusive and transformative recovery education service here in the Midwest, covering Limerick, North Tipperary and Clare, but we're also online too, which is obviously why we're here today. This is part of our webinar series that we run monthly in partnership with Mental Health Ireland, and I just want to give a big shout out to Mental Health Ireland for all their support in putting the webinars together. We really couldn't do it without them. As I said, we're looking at innovation and change in the mental health services today. We ran this back in, well, part 1 back in September last year. We didn't think we were going to go for part 2, but we got such a great response to that one, both at the live event and for the recording as well, that we thought we'd extend it to part 2. And who knows, we might even go to part 3. So today we're looking at all the positive changes that are happening and have happened in the mental health services. We know obviously there's lots of challenges too, but it's nice to consider what's happening out there and how we can actually, get involved and looking at the positive side of things. So before I introduce you to my lovely panelists today, I just want to go through a little bit of housekeeping with you. We're on for an hour, so we'll be here till 3 o'clock, and I hope that you can stay with us. So grab a cup if you're close to the kettle and come and sit with us. It is a discussion, so obviously we'll be discussing with the panel, but also we want some questions from yourselves. Now, I just want to say a big thank you to those who actually submitted questions prior to today's event. Thank you for taking the time to do that. I will do my best to make sure that we get to as many questions as we can. For anyone who does want to submit a question, there's a little Q&A button there at the bottom, and you can type in your question there and submit it, and you can even submit it anonymously. We would love to hear from you. It is recorded. That's the main thing. I think you might have noticed that. It will be available on our YouTube channel, and that's actually where we get a lot of our traction for these webinars. And also we will have it as a long form podcast on Anchor FM, Spotify and Apple, and anywhere where you get your music or listen to podcasts, and that's called the Wellness Panel. I think that's it. I think actually what I'll do now is actually ask all of our wonderful panelists there if you can turn on your video so we can see you. And let me just tell you a little bit about who we've got today, and then I'll go to each of you and just ask if you could just give a little bit of information about what you do and your role. So, joined as always by Mike O'Neill, our manager here at Mid West ARIES. It would feel very strange for me not to have Mike here with us today. So Mike, I'm sure, will be telling us all about the interesting stuff that's happening on our end in recovery education. Also, I have Mick Collins, who's the resource officer for the Suicide Prevention Office. And thanks, Mick, for coming today. I know you were with us, I think, back in November for the men's mental health webinar, but delighted that you can join us today and that you can let us know what's happening there. And Michelle O'Connor. Michelle's been a great stalwart of Mid West ARIES, always a great supporter, but she's here today in her role as individual placement and support specialist. So this is something I'd say, Michelle, a lot of people don't know about, so really looking forward to digging a little bit deeper on that. And we're also joined by, again, delighted, the lovely Amie Hughes, who's the area coordinator for GROW. Amy's great, and again, dying to find out what's happening there. And big thank you as well to Karen Bergin, who is joining us there. She's the online services manager for Aware. Again, another great organization that does really great things for people with mental health issues or mental health challenges. So I think that's everybody. And what I'll always ask Mike to do is, if I miss anything out, Mike, come in and bring us back on track. So let's start with that all-important round of introductions. I've just given you the title, but tell me a little bit about your organization or your service and your own role. And we might just start, Mike, should we start with you? We always start with you.
Yeah, thanks, Margaret. And I think you've covered it all. And I suppose, again, we are Mid West ARIES is the recovery education service. in the Midwest. But I suppose, again, I'll try and hold fire as much as possible, because we're going to talk about innovation and change and what's coming and what's different, and the potential. But I suppose delighted to have the second one here. And so on our YouTube channel, you will find part 1. So again, there was different participants. And I suppose it's one of the things we looked at here is that, yeah, we work closely together, the different organizations, and we collaborate a lot. And people just don't get to see that too often, like kind of, well, what does that look like? So I think this was an opportunity kind of to say, yeah, as you correctly said, Margaret, there's great stuff happening. We are responding, to the needs of the community in the Midwest. And there's just different ways of doing it. And so there's a whole range of options out there for people. And so delighted to be able to give the opportunity for people to come along, promote what they do, showcase their work, and hopefully can just make it known that what's available in their community. Thanks, Margaret.
Thanks, Mike. Appreciate that. And I'll just come to Michelle. I'll come to you next, just because you're next on the screen for me. Again, just a brief introduction, please.
No problem. Thanks, Margaret. So as Margaret mentioned, my name is Michelle O'Connor, and I'm the employment specialist based here in Willowdale Day Hospital. And like Margaret mentioned, it's new enough in terms of the mental health services. So I'm in post over 3.5 years, and there's myself and 2 other colleagues in the Mid West region. But it's kind of all over Ireland on a pilot basis, but is becoming more embedded in the services, which is kind of helping people who are using the mental health services in either entering the workforce for the very first time or returning to the workforce following mental health challenges. So it really is taking into account that different aspect of their life and looking at what else is important in recovery. And I definitely think we can all agree that work is so important for us, socially, financially, and all those other kind of aspects. So that's what I do.
And thanks for that, Michelle. Again, you're absolutely on the money. Obviously, we deliver recovery education modules, particularly in the acute services, and work, employment, it comes up again and again, that meaning and purpose piece that we always talk about. So delighted that you're here to give people that information. I think it's so important that people know it's there. I can't believe 3.5 years already. Wow. And so much work done, good work done. So I'll just pass you now to Amy. Amy, do you want to say hello there, please?
Sure. Hi, everyone. So I work with Grow Mental Health. We're a national organisation, but I work in the Midwest. So that's Clare, Limerick and Tipperary. What we do is mental health peer support groups for adults. So that's a bit of a mouthful, but what it means is it's a weekly meeting where people who are all going through some sort of mental health difficulties can come together and they just support each other through that. So my role as the area coordinator, is to make sure that the groups can function, but I'm not like an expert in the room. So the group is very much peer-led and peer-run, run by themselves, and that's shared, that kind of leadership among the members. So that's what we do. We have 11 groups in the Midwest, and they're all up on our website if anyone wants to see kind of where they are, but they're spread across Limerick, Clare and Tipperary.
That's great, Amy. And at the end, we'll be giving those signposting slides, those all important information of how you actually access those. And you do such a great job in Grow. And again, that's part of what we do as well in terms of that, like for us in terms of recovery education, that peer-to-peer learning. There's so much power in talking to somebody who's walking the same or a similar path to yourself.
Yeah.
It is. It's the secret sauce, really, of a lot of what we do, and I'm sure of you too. Karen, I might come to you next, if that's okay.
Yeah, no problem. Thanks, Margaret, for the introductions. So my name is Karen Bergin. I'm the Online Services Manager at Aware. So for those of you who may not be aware of Aware, we're the national organisation that provides support, education and information for people who are impacted by depression, anxiety, bipolar disorder and related mood conditions. So we can often be either the first port to call for someone if they're unsure about where to start with their own mood. We also offer ongoing peer support in the form of peer support groups for someone who's looking for support kind of on an ad hoc basis or an ongoing basis, including every Thursday evening in Limerick. And then we also offer a suite of free mental health programs for people who experience anxiety, experience depression, living with bipolar disorder, or looking after a loved one who experiences mental health difficulties as well. So all those programs and supports are offered for free. And that's a bit about Aware.
And that's fantastic. And having that free bit is so important, particularly at the minute, you know, cost of living crisis, and where people are very, you know, are struggling to have an access point like this. And I think, again, what's really interesting is the peer piece again coming out, and the family piece as well, because it's so important. You know, mental health challenges doesn't just happen to the individual, it happens within the context of the people that you love and who love you. So yeah, thanks, Karen, and really interested to hear what's coming next for you guys as well. So Mick, we might come finally to you in terms of, you just want to introduce yourself there.
Thanks, Margaret, and thanks for the invitation to be part of this today. And thanks to Mike and the rest of the team as well. Mick Collins is my name. I work as a resource officer in suicide prevention here in CHO3 Community Healthcare, which covers Clare, Limerick and North Tipperary. The office we work in is the Office for Suicide Prevention here in the Mid West. Just to say that there's a resource officer in all the CHOs around the country, and we do a similar type of role in all the different areas. So if there are people from other parts of the country and they need the contact details for my colleagues, I have no problem finding or directing you towards that. So the Office for Suicide Prevention in here, we're based in Limerick at the moment, and there's three main areas to the work that we're involved in. The first one is, I suppose, the Connecting for Life. Connecting for Life is the national suicide reduction strategy that's in place at the moment. Has been in place since 2020 to 2024. So we're in the middle of the second cycle of Connecting for Life. The original one was launched in 2015. So from that, each area developed their own local action plan, and our local action plan is Connecting for Life Mid West. So to that includes a range of stakeholders, statutory, community, voluntary groups that have an interest in suicide prevention and supporting those that might be vulnerable or at risk of suicide. So currently there are 3 county groups that meet on a quarterly basis, one for each of the areas, Limerick, Clare and North Tipperary, and those groups have been in place since last year. So that's a really good thing that's happening. So that's our Connecting for Life piece. The second piece is the response work that we offer, and that's we respond to those that are at risk of self-harm or suicide, or those that support them. The other part of the response work is that we respond to communities or individuals or families that are bereaved by suicide as well. So that's a significant part of the work and really important part of the work that we do. We're not a clinical service as such, we're more of a signposting direction service, but we also offer supports to actual communities. We go out to communities if that's necessary. The other part of what we do, and it's probably the most well-known part of what we do, is we deliver a range of free suicide awareness, suicide prevention trainings, and some of those trainings are Safe Talk, Assist, Understanding Self-Harm, and we have an online program called START at the moment. So that's just a brief overview of the 3 main areas of our work.
That's perfect, Mick, and thanks for giving that kind of overview, because again, and there's a lot to be covered there. So it's great at the end, we could, you know, with the signposting slides, that if people need to contact you with regards to the training or whatever that looks like for them in terms of their needs, or if they need some you know, signposting elsewhere, that'll be there at the end. So thank you all for just sharing a little bit about your role. I think at this, did I get everybody, Mike? You have, just making sure.
Definitely, yeah. All
good stuff. So I suppose let's get to the meat of it now. And thank you, by the way, for the questions that are starting to come in. I'll get to those shortly, but I just want to, I suppose, get to the main question, which is, we talked a little bit, you know, or reflected a little bit in that secret sauce of your organization, your service. Like, what do you think is probably the 1 or 2 of the main innovative things around your service? So who'd like to come in first on that?
Yeah, sure, I'll go first, and I'll get it done. And So I suppose even this is an example, even for us all, like to be online, live webinars. Who would have thunk it, you know, all of those years before COVID? It was never really an option or an opportunity. But I suppose it is a way of then responding to the needs about being online, you know, then I suppose coming out of COVID to be able to go back online, operating hybrid models. So to have that inclusion there then and increase that access for people to attend. And I suppose one of the big things for us is we've started to develop online 24/7 self-paced courses that people can access recovery education as well. So yeah, and I suppose ARIES itself is part of the innovation and change. And I know in a different life, Amy would have been involved as a project worker in service improvement. And the fruits of that now are coming through now, whereas through that service improvement office, like we have Mid West ARIES. Michelle, again, the employment specialist, those were areas that were highlighted. And again, when we talk about the potential for having another webinar, what's innovative in the mental health services, it's peer support workers have come into post now last year. So again, it's responding to the community needs. So, and I suppose, again, COVID for many people was a challenge, but it was a tremendous opportunity to create new ways of doing it, and we've done it. And this is an example of it. So thanks very much, Margaret.
Thanks, Mike. That's great. And yeah, I think it's really interesting that we have on the panel today, you know, two people that are directly out of that, you know, or two roles that came out of kind of service improvement. And with that in mind, Amy, you've got your hand up, and then we'll come to Karen next.
Yeah, thanks. Thanks, Margaret. Yeah, so I suppose from a GROW perspective, I used to work in service improvement, but I now work with GROW. We have that kind of blended approach as well that Mike was talking about, which never would have happened if it wasn't for COVID. So when COVID happened, we moved everything online because we had to, and it was brilliant. It meant people could still get their weekly meetings, but it went on much longer than anticipated. Now, thankfully, we've been able to reopen our face-to-face groups, but we've also realized that by having an online option, we can reach so much more people. And by having the blended approach, they complement each other lovely. So it's not just our peer support groups, though they are the main part of our work, but like over Christmas, we were able to run like a wellness recovery planning for Christmas, and we were able to open that to the whole country. Whereas normally, if you do that in Limerick, you can only bring the people that can travel to Limerick. And likewise, there's people who attend online groups who might start going to like face-to-face meetups and stuff like that, our social kind of events. So they really complement each other lovely and give our members far more things to kind of engage in and allow us to reach far more people.
That's perfect, Amy. And again, we'd echo that in terms of the blended approach. Mike's obviously said it there. It's so important. It gives people options and access points. It's great that I suppose COVID was a challenge, but it also presented lots of opportunities. And I think lots of organizations found new ways of communicating and supporting their cohort. Karen, we might come to you next. I think you're next, and then Michelle will come to you.
Yeah, thanks, Margaret. Yeah, like what's been mentioned already by Amy and Mike, the opportunity to have this kind of dual approach to how we deliver our services has been really transformative. And I think, you know, what might have taken 5 or 6 years to happen, it kind of happened in 5 or 6 months. So I think it was Mike who might have said at the last webinar that sometimes people might see it as a challenge, but people in the mental health space chose to see it as an opportunity. So yeah, it's been great. And like many other organizations, we were able to incorporate a hybrid model, obviously during the pandemic. It was predominantly online, but now that we've come out the other side, kind of to some extent, we've been able to back up some of our face-to-face offerings, and that has included Limerick. So we have a group in Limerick that happens every Thursday evening on Sexton Street. And so that, again, that's a peer group that's free to attend, facilitated by 2 volunteers from Aware. And we've just found that kind of idea that, look, what recovery looks like for each person is individual. That kind of person-centered approach is really helping people to understand that they are the expert in their own experience and know they have a lot to offer, even though sometimes they can sometimes feel like the opposite. So we've been able to see an increase in attendance at our face-to-face options, but we also have still remained with the online options. So we have Zoom, and we had phone-in groups going for a while as well. We still have one of them operational. So prior to this, we would have only ever been able to do it face-to-face, but we were kind of forced to be a bit more innovative and look at different ways we could approach it. And then we were able to also launch a new program last year, which is our Living Well with Bipolar Disorder program. So that's a free, again, 8-week program that's kind of educational in nature and aims to provide an opportunity to understand and manage the bipolar disorder effectively, and essentially equipping you with knowledge and tools to live well. And after that program, people can also take part in a free 6-month follow-on support group, 6-week follow-on support group to help just integrate what they've learned in their day-to-day life and kind of share with others what that experience has been like. And then from there, there's an ongoing follow-on group that they can attend weekly as and when they choose. So we've seen a really, really good interest in that, whether someone's newly diagnosed or has a long-term diagnosis. It seems to work quite well for both. So yeah, a couple of changes coming our way.
Thanks, Karen. That actually sounds brilliant. And we need to actually, Mike, I'm just thinking as we go, we have learner packs that we send out every week to people who come attend our recovery workshops. So it'd be great to have signposting there to signpost to your individual kind of online offerings as well. I think what stood out for me on that was, which is absolutely so true, the speed of innovation. I think that's what COVID made us do. It made us think quicker. We had to respond quickly, or else we were going to just be treading water. And, you know, and that's a good thing. And the fact that we've learned from it, and that you're actually, like, we're all implementing a kind of blended approach or a hybrid approach now to make sure, as I said, that we've got access points for everybody. Thanks, Karen. That sounds really interesting. And Michelle, I'll come to you next. And then finally, Mick, will come to yourself.
Yeah, I suppose what kind of has stood out for me over the past few years is really kind of taking the kind of mental health awareness to kind of into the community and kind of the business side of things. So I work a lot within the business community, employers, a lot of local SMEs, sometimes multinationals, and it's really kind of taken that into the workplace and saying, you know, how can you recruit differently? So I think that's really big piece of innovation, in that not only are we doing the work in the mental health services, but we're taking that outside it as well, because you know, this can and does affect everyone, but sometimes in the business and kind of the different type of industries, they don't see themselves as being part of that conversation. So there's a huge part of kind of development there, education that I do, and kind of really knocking on doors to get people to think differently about moving away from the mainstream type of recruitment, where, you know, if you have big gaps in your CV, you may not be as quickly selected, and really trying to get people to think differently around recruitment, so that you're kind of tapping into this untapped resource of workforce that are very eager, resilient, and skilled workers. So I think that's been a really huge piece of innovation so far that I've noticed in my role.
Absolutely, Michelle. And I think even by you having that conversation, it sounds like with organizations or recruiters or whatever, you know, you're making them think about even their own staff's well-being, that whole kind of conversation that's out there. I just find that really, really interesting, and that you're providing that bridge between the two.
Yeah.
And it's we know that's a problem in terms of gaps in CVs. We hear it all the time. Like, how do you explain that without, and the whole stigma that's involved in that? And,
yeah,
you know, so it's hugely important, hugely important. Thanks, Michelle. Mick, we'll come to you finally, and then what we'll do is we'll have just a review of the questions that we've got from the audience. Thanks.
Hi, thanks. It's great to hear the innovative ways that people have had to adapt, particularly over the last couple of years or so, and look at that's applied to us as well, because a lot of the trainings that all our trainings are free, and a lot of the trainings we would have done traditionally would have been face-to-face, because we have, you know, always felt there is huge learning by being part of a group within a room, that people learn from the facilitator and learn from the people that are participating with them, you know, from their own experiences. So we've had to move some of our trainings online as well. So just for example, tomorrow we've my colleague Adele, who's a training and development officer, she's delivering a 2-hour understanding self-harm to one of our staff teams that work with priority groups. So that's an introduction to understanding self-harm, which is a 2-hour online one. That would then lead to a 1-day face-to-face training. So we've had to be creative around how we, I suppose, promote the trainings we have on offer and how we access them. One of the other things that's coming on stream currently is the trainings that we offer are a lot of them are provided by an organization called Living Works, which is Canadian, and there's been some commentary around, okay, well, why can't we develop our own trainings from an Irish perspective as such? And that's about to be launched at the moment. There are going to be some Irish programs coming on board soon. So that's a change for us. We've also had to, because we weren't able to go out to communities in the aftermath of a suicide, we have been able to offer and deliver our community response on an online basis. Now, it possibly it maybe isn't as effective as being in person with a group in a room, but we certainly feel that it has been able to support communities in a time when they would be really struggling in the aftermath of a tragic event like that. So we've had to adapt and change as well. One of the other changes that's happened, and we've welcomed it greatly, is we've got another resource officer in the area as well. So we now have 2 resource officers, and my colleague who's just joined our office, Jenny, she's going to cover Limerick City and County, and I will cover Clare and North Tipperary. So they're just a couple of the things that maybe have happened with us.
Thanks, Mick. And it's great to hear, and it's great to hear the service obviously expanding with the additional resource officer as well. You know, so the offerings, you can extend the offerings as well, because it's so important. I'm just listening to you all there, just reflecting on. Every year we give an input into UL on innovation and change in the mental health services. We're doing the same this year. It's great to be involved in that. But one thing we always discuss is like change and innovation, and how they're almost 2 sides of the same coin. And sometimes you might have an innovative idea, but people experience that as change. And sometimes change can be uncomfortable. And that's the same with organizations as well. So it's so important to bring people along with you when you're changing or innovate, or putting them at the center. And I suppose from our point of view, Mike, is that co-production piece. I think that's the biggest innovation for us. And you're bringing people with you right from the get-go. I don't know if you want to mention anything on that, and then I'll go to the questions.
Perfect, yeah. And just on co-production, I suppose it's kind of one of our taglines. And again, that presentation Margaret will be doing in UL, I suppose, to future mental health and health professionals as part of their education program. It's what happens when you ask people. And it's crucial that you have all of the relevant stakeholders at the table, because then you get buy-in. So that's where it's part of being you're responding to the needs. And that's the beauty of everything that we do in Mid West ARIES, from our courses, whether it's in acute units, in the community, and the stuff then that we will be doing in the future and self-paced. We're responding to the needs. It's responding, what do people ask for, rather than saying, I think this is what you need to know. I'm the professional, I'm the expert. So when something is co-facilitated with staff, family members and service users together, it makes everybody's life and everybody's job easier. And so that's the beauty of co-production and that's part of the development phase. In the beginning, you have those sessions, but it's a process that we use. It's a cycle that we use all the time, where we go through. We're constantly taking the evaluation at the end of our workshops and our courses, and we're editing and changing. And it's a constant wheel, so it's always up to date. So we take the feedback from every workshop and edit and change as we see fit. And again, it's that part of being that responsive service.
Thanks, Mike, and thanks just for putting that out there in terms of co-production, because I do think it's a really important development, really, in mental health services, using that approach to everything. It really does help. But anyway, I think it's time just to have a wee break from change and innovation and just take some questions. So, Michelle, I'm going to come to you first. So in relation to the employment specialist service, have your clients faced discrimination in accessing employment? Do you advocate their mental health challenge should be kept hidden or disclosed? depending on the role they seek. Sometimes education towards employment is a recovery goal. Is your remit inclusive of supporting access to there's an adult education path? A lot to unpack there. Even if you just take one of those, would be great.
Yeah, so in my own experience personally, and this will be different, I suppose, for everyone, I haven't found that employers have discriminated against people because of their mental health. Now, I suppose I approach employers, discuss what I do, kind of do that education piece before I put clients forward for a role. So I think there's already that kind of level of understanding compared to maybe someone who doesn't have an employment specialist kind of doing that nearly like pre kind of screening of an employer before you kind of put yourself forward. So to be honest, I find that employers are extremely open, and if not understanding based on their own personal, family, community experience of mental health. So I definitely think that's really changing. But again, not to say that it's not out there. It's just, it's not been in my experience. In terms of advocating around the mental health and disclosing, I don't really advocate for keeping it hidden or giving that information. I really just assist a person in exploring that, making that decision themselves, looking at the benefits or maybe kind of the reasons they may not want to. Some clients never ever disclose to their employers, some do and want it disclosed immediately. So it really, really depends on the person, and it's really just kind of helping them explore what their decision might be. I do also look at education, and I agree with you that it's a major recovery goal. I do facilitate short, not so much kind of the degrees and things like that, because they're longer pieces of work, but I've facilitated a lot of short education goals that would help lead to a job, whether that's safe pass, care, becoming a healthcare worker, those kind of shorter terms. I would facilitate that and kind of funding that might be available. I work closely with the Department of Social Protection because I'm also co-based with Employability Limerick. So I do also advocate to the department to see if we can get funding for courses also. So we definitely try to do whatever we can do to get the job. So whatever helps, we do that. But I say we, it's just me. I say it as if I'm a full department.
I love that. I was thinking that, Michelle. I was loving that. I'm going like, but that's, I mean, the job is that wide ranging, and it's that, and it is. It's just so important to help somebody navigate that.
Yeah.
But thank you for answering that. Yeah, really appreciate that, because I know it comes up again and again and again, and the stigma piece as well. Speaking of stigma, I'm going to come to you, Mick, with this question here on the Suicide Prevention Service. Does the Suicide Prevention Service address the stigma attached to suicide attempts as a sign of mental disorders, illness, when it's not always so? How do you do this? If you can answer that, fine. And if not, if we need to signpost, just let me know.
Yeah, that's I suppose it's a really good question, really important question as well, because what I referred to earlier was our understanding self-harm training. As those of you that may have some knowledge of self-harm can be perceived lots of different ways by different people. For some people, it can be a way of helping them deal with incredibly difficult and strong emotions. It may or may not be concerned with mental health difficulty or mental health challenge. It may be to do with an adverse childhood experiences that they've happened. We, I suppose, in the course of our work, are open to exploring all the reasons what make people vulnerable, and is trying to understand that will be different for everybody, and we're all on a particular pathway or journey, and we've all had particular personal experiences in life as well, which can make us more vulnerable. Some of us, may have a formal mental health challenge. Others may experience challenges from experiences they've had in life. So I think we take everybody's individual experiences separately and try and support them and understanding themselves and what way they've come onto, but we do that in a collective way very much through our trainings, because there are particular people that are more vulnerable to suicide. There are particular priority groups, and we're very aware that those that experience mental health challenges are more vulnerable to suicide. So making that information and knowledge more open and increasing awareness of those challenges is very much part of the role that we do. Promoting the services that support people that are vulnerable as well. We target particular staff groups that work with vulnerable groups and provide the training for them as well, to try and help them, I suppose, explore their own thoughts and views towards those that do engage in self-harm or that are vulnerable to suicide as well. So we try and be we try and be as open as we can in terms of addressing things in that way.
Perfect, Mick, and thanks for giving that answer. Again, there's actually quite a few questions there for you, Mick, which I knew there would be, because it's such a relevant topic for so many people. So what we'll do is we'll try and get some more questions to you later, but I just want to make sure everybody gets an opportunity to share. With that in mind, I'm just going to go to another question that came in by email. So is there any consensus within, and anybody can answer this, but Mike, it might be more appropriate for yourself. Is there any consensus within the HSE to create a person-centered model of recovery where there's more focus on treating the person as a whole and the various parts of their life rather than the focus on medication?
Yes, and I suppose that's what we call the recovery model, and that looks at personal recovery. And the first published National Framework for Recovery and Mental Health came out in 2018, and that's to be extended as of now. And part of the remit of that was to use, so for any innovation and change that takes place in the mental health service, it is use the co-production model. So whatever that looks like, it is to involve obviously the clinicians, because they work in the service, but bring in the service users, the family members, and the people who use the service in particular, to start those conversations of what that change looks like. So therefore you're producing, you're making change that is fit for purpose. And part of that work, as I say, so we are part of the mental health service. So we're part of the HSE Mid West Mental Health Service, and we are part of that change. And part of our remit in that is for staff training. We run what's called Recovery Principles and Practice training, and it is asking people to look at their work practice and how can they make changes if they're not already doing that in how they work with people. What is their person-centered approach? And very often, I suppose, in our experience, people are doing it without being aware. Because again, when we look at why are all of us here working in the jobs and the roles we're in, I can guarantee you it's personal. Why do people work in a difficult area of mental health? It's personal. So it's made up of real people who want to make a real difference, and instinctively they're already working in a recovery focused way. So, and very often they're not aware of it. And it's only that, so there's also that reflective piece in attending those workshops as well. So while yes, people have been doing it for a long time, their training is there and it's available. And I suppose going forward as well, nationally as well, I suppose I've been pushing for, and we're going to do it, is start to create a suite of modules to how people can work in a recovery focused way, because there's lots of ways of doing it. And, so it's not just a one-off thing. So it's to provide people with the skills, the knowledge and the tools to do that as well. But it is being supported locally and nationally. So as I said, sometimes people say, well, what does the recovery focused model look like? Well, we're part of it. So this is it in action, So again, so it is joining all of those dots. We are part, as Amy mentioned earlier, being part of that service improvement, bringing about those changes and responding to, the needs of the community. So again, I could bang on about this.
No, and that's perfect, Mike. I think that's a really good a good answer. And if anybody else wants to come in on this, just hands up or just come in. Amy, is that yourself?
Yeah, I might just come in there, Margaret, just
Please.
to agree with what Mike was saying. I think even the fact that we're here today, and you look at all the organizations and what they're doing, like I know Grow, for example, are funded through the HSE to do the peer support work. But also, like in the last 10 years, that peer element has become so much kind of more valued, I suppose. And when I worked on the service improvement team and when I worked alongside ARIES, 50% of the staff were peers. So that's just people who have been through, mental health difficulties or have used the service. And that kind of that really breaks down the stigma as well, because there's no them and us then. It's just all of us working together. We're just all people. So many people are affected by mental health difficulties. It couldn't be them and us, you know. So I think that recovery kind of language and recovery principles and all that, it's there, but it might be slow, but it's definitely there, and you can see all the changes even just today, like Michelle in IPS, and you know, like all the digital services that have come on stream and everything. So yeah, it's getting there.
Perfect, Amy, and thank you for that. Absolutely, I think so, and I think that's why it's important to have these discussions, to make people aware of that, because sometimes it can be difficult to see and experience, and we need to change that. That people do experience that.
And I think just to add on to that, and
sure.
Again, I forget this stuff as well because we take it for granted. Just not my camera shaking there, but you know, when Mid West ARIES, there's 9 people on the team, you know. And we're all here because it's personal, and we've used the mental health service. You know, we're all employed in the mental health services in the Midwest to bring about and achieve that change. And as Amy correctly said, and sometimes we forget, well, what motivated us, or you know, so we are being supported. You know, so it's not on us and them, as Amy correctly said. Yeah.
Thanks, Mike. And Mick, I know you want to come in on this.
Thanks again. Just to follow on from what the lads were saying, and maybe bring in the stigma reduction part of it. I think the whole development of co-production peer work is hugely important in breaking down those stigmas that are attached. There is, to some extent, I think, a stigma attached to mental health challenges and those experience mental health challenges, but there's also a stigma attached to suicide as well. And they've been, I think, ingrained in our society for a long time. But I think innovations like the co-production, the peer work, are ways that's been certainly been reduced. And I wholly support that work to continue in that way. I mean, there's also formal stigma reduction campaigns like the Green Ribbon campaign that happens every year, and we would promote that work as well. But the more informal promotion of stigma reduction goes on through events like these and through organizations like those that are here today, by just promoting the work that they do and making increased awareness of the peer involvement, which is hugely important role in my eyes.
Thanks, Mick. It is. I think the peer piece has really led to some really interesting and I suppose sustainable positive changes in the mental health service, having that peer piece embedded. And it kind of brings me to, this is a question that I had before. We were already there. Like, what changes have you seen in mental health service and organizations, not just necessarily your own, over the last couple of years that you think people should know about? Karen, I know you want to come in, so just generally on that topic anywhere, or the question we've had before.
Yeah, and I think it kind of echoes a little bit what's already been discussed here. I think it's just helpful for people to understand that kind of greater integration of person-centered approaches to mental health services in Ireland. So while things like stigma are improving, there continues to be concerns, continues to be worries about, you know, where do I get started? What options are available to me? You know, do I have a right to get in touch with somebody? You know, all these questions that go on for people, which makes so much sense, particularly if this is the first time you've experienced a mental health difficulty. So I suppose it's really important to know that there's lots of organizations that are here and other organizations that you can get in touch with. So, for example, if you got in touch with someone in Aware, whether that's, let's say you rang up our phone line and you were thinking, I'm a bit concerned, I'm not sure where to start. It's important for the person making that call to understand that there is an understanding in the person that you speak to, that you're the expert in your experience. So people say, sure, what would I say? What do I know? Where do I begin? So I think that piece around when you reach out, and if it's, you know, any of the organizations here, or you wanted to go along to a Grow peer group, that idea that the people you're showing up in front of understand yourself best. And so we can help and support you, but nobody's dictating anything to you. Nobody's taking control out of your hands. You know best what's right for you. And I think more and more as every month and year passes, all the organizations that are working kind of in the mental health field are getting closer and more closely aligned to that piece. And that, I suppose, it's a meaningful distinction, that it's important that everyone in the public understands that. So you might be feeling a little bit nervous, that's understandable, but remember, you are the expert. And I think for a long time, the messaging has been very top down. So we just really want to, I think what everyone has said here today is so powerful and meaningful to understand that it's very much bottom up, and people are the best suited to understand what recovery looks like for them. And also to know that, webinars such as this one further cements that idea that mental health services are collaborating and working to ensure that they know what other services are doing as well. So again, to understand, you might come along to Aware, but figure out this isn't the right fit for me. But by getting in touch, you'll find out what may be potentially a better fit for you, that kind of way. So it's not that anyone here watching this needs to have all the answers, and to know that the person they're speaking to doesn't claim to have all the answers either, but there's greater kind of integration between organizations and understanding and signposting and listening. The listening is a really core part of that kind of person-centered approach as well, which is fundamental to Aware, but I can also hear it's so fundamental to the organizations mentioned here and so many other mental health services. So I think just if the public or anyone watching this could walk away with that one message, kind of the idea that you know more than you give yourself credit for.
And I think that is a really important message to take away for anything, above anything else, particularly if you're reaching out for help and you don't know where to go. But it really takes, sometimes it takes a lot of courage just to make that first step. And it's how you're received is hugely important. And by having a person-centered approach, people feel that, they, as you said, they're being heard, they're being listened to, and that's half the battle a lot of the time. And we find that all of the time.
Yeah, and hence courage is the right word. Courage is a very strong word. Yeah,
it feels strong, but
yeah,
it can be very difficult for people to make that first to reach out.
Absolutely.
I want to go back to just some of the questions here, because they're kind of linked to, and I love this one in particular, because we know change, innovation, it doesn't happen. It can seem to happen overnight. COVID forced everybody to innovate by the sounds of things, but it takes vision, it takes time, it takes money, it takes budgets, it takes all those things to put together. And there's a couple of questions actually on that individually. So one is, have you met resistance and barriers within the organizations, and how did you overcome them?
Well, I suppose for us in ARIES, there was, because we're part of that change, but when you bring in, people with mental health, illness, challenges, disability, whatever way you want to look at it, so sometimes while that might look great, as we say, it's like me, if I say, to somebody, say, oh, there's change coming. Well, what the other person's response is, well, what does that change look like for me? Do I have to compromise, and is there a price? And I suppose there was a line that and I'm going to be brutally honest here, when we talk about, because it has come up here around stigma, and but stigma, and I suppose our mental health is not a barrier to doing a good job. Because again, there's lots of people working within the service. But it was said, when I moved into an office one time here in the HSE, we can't have these people, it was said to my line manager, we can't have these people, wandering around the building. And that was me. And I'm started my 6th year. So this isn't like back in the time of the dinosaurs. But how do you overcome that? It is using co-production, building and operating a quality service and a product and a brand, and meeting the needs and of the community, where you then become recognized and valued. Because a lot of what we do now, a lot of within the service, people come to us looking for assistance, because the evidence is there that people who have mental health challenges are whizzing and banging and leading the charge, and like breaking down those barriers by being actually good at what we do. Because the comment there is, we get it, we live with it, we understand the need, and we're responding accordingly. So that's how you do it. with evidence of good work, you know. So then we're seen as part of the solution and not the problem, you know. So again, it's so it's not easy. So stigma is alive and well and real, you know, and that's, we could have another webinar on that, and maybe we should, you know.
And I think we actually should, because it comes up every time, and yeah, it's part of the equation. Maybe it's not the nicest part of the equation, but it's there and it needs to be addressed. Just in terms of, there's this one here, just I think it's interesting. I've seen, this is a question come in, I've seen recently as a HSE employee that there has been additional funding for mental health, in particular women's mental health. Have you all been allocated funds accordingly? And if so, how do you plan to allocate them? Now, I know, does anybody want to come in on that? Are they in a position to? So I think Amy's going to take this one, Mike, and then we'll come back to you. Yeah.
I don't have the answer to if we've been offered funding or how it's been allocated. I just don't work in that area, but I have seen, just to say, I've seen the same thing. So like, for example, in the Midwest, we have the perinatal mental health services now, which has been a really great addition. So that's for people who are pregnant and also post-pregnancy. But also I've seen Mental Health Ireland have been running, I think it's Claire, has been running locally, like, you know, menopause cafes and things like that. So definitely that conversation and that is shifting. I'm sorry, I don't know about funding or allocation, but just to say I've seen the same.
No, and I think it's important to say that, I mean, we're in the same position in terms of, well, certainly I couldn't answer that, but the perinatal piece is so important for us, and we're partnering with perinatal in terms of workshops and so on going forward. We're really excited to, because I think what they do, that's definitely, we'll have to have another webinar for more innovations, because I think that's something that we need to put the focus on as well. Mike, did you want to just come in on that?
Yeah, no, and again, being open and transparent, like, I suppose maybe I'll get shot for this, but there was a 30 million allocation in the budget to mental health services. What came towards recovery education nationally was just over 100,000. And so we applied for some of that funding and we got 17,000. We don't, and I suppose again, we operate on it. We don't have a budget here, you know. So again, that's why we partner with organisations like Grow, and other community organisations where we can deliver the product. And it's like, even so, particularly for women, I suppose that's kind of for this year about to change. It is about becoming more targeted in our response. So we will be looking at, we are working with perinatal, we have stuff planned and we will deliver. But what that money has given us is it's allowed us to purchase like resources that will enable us to enhance and broaden the service. So it is like the online self-paced courses. There will be lots more of those done. An example out of that where that allocation of funding will be utilised is Margaret will be working on this one, but it's about preparing and getting the best out of your appointment. You know, so it is really crucial. It'll have like checklists, worksheets, very practical piece, you know. So again, another one, maybe understanding, a psychiatric assessment. So giving people the tools and the knowledge to be able to go back and advocate, on their behalf if needs be. But knowledge is power, it empowers people, you know. So we got, it was a once-off budget. We've spent it wisely, but it is about spending it to broaden and enhance the service. So specifically for women, another one that we're looking at, again, it's early days. We've started a conversation with an interagency group out in County Clare. And the working title of that piece of work, what it will look like, but we're only having the conversation now about looking at what a co-production piece. It may be an education piece, it may not be, but that is meeting, again, responding to the needs in the community. And the title of the work and that piece of project now that we came up with is, it's parenting while living with mental health challenges. So again, people say, here's a need, how can we respond? And that's what we're doing. We're just getting on with it, you know. So, and there's lots of stuff that we have planned. Like everybody here, as Michelle says, when I say we, it's me. And again, in ARIES, it's a small development group. It's like Amy and Grow, you know. So you can't be all things to all people all the time. But we're doing our absolute best, you know. And I'm sure Karen, in a way, is probably exactly the same, you know. So again, we know mental health, as a percentage of the overall budget to the HSE, I suppose proportionally it has declined over years, you know, whereas if you could look at those figures, whereas I think it's between 12 and 15% in the UK, it's something like 5, 6% here. Anyway, I'm rambling on.
Mike, I need to just come in there because I'm just mindful of the time and I want to make sure everybody has a little bit of time at the end. I'm also mindful that, thank you. I just want to thank the participants because they're putting in the questions there like Goodo. I wish I could get to all of them. Mick, there's quite a few of you there. If you want to actually individually answer, you can type an answer there into the group if you want to, if you have time to, that's grand. I know there's somebody there that asked Mick specifically for signposting to Dublin. I'm going to actually give you Mick's details that you can contact him afterwards right now. I want us to, like, we've only got like 5 minutes left. This thing just goes by so quickly. I'm actually going to bring up the closing signposting slides, but I want to use this opportunity now to kind of bring it together a little bit. And so if you can let us know if there's anything coming up or something that you feel that we've missed out that, you know, you want to say, if there's a message that you want to go out there. So Mick, I'll leave you to the end so you can do that. And if you want to if you type the answer there and you can share it with the entire audience. I'm actually going to just share, and please let me know if you can see that. Can you see that okay? Yeah, so I'll just bounce very quickly through ours. Obviously, recovery education is what we're about. In February, we're having recovery workshops online, and you can book for those on Eventbrite or get in touch with myself. I'm margaret.keane9@hse.ie. We also have our next webinar next month, and hope you can join us for that. Struggling with sleep, what can I do? As I said, somebody asked me, what would your superpower be? For me, it would be sleep, because I don't know what a real good night's sleep looks like. Now I want to actually, and it's just yourself, Karen, has come up first, but to use these closing slides, as I said, we've only got a few minutes left. Just kind of your thoughts on today's discussion, or if there's anything you want to highlight from Aware that you think people should know about, or even generally in terms of the mental health services. I'll come to you, Karen, first.
Yeah, just to let you know, in the Mid West region, as mentioned here, we have the Limerick Support and Self-Care Group that takes place every Thursday at 7 p.m. And just to note, they're free to attend, no referral needed. It's kind of an open, supportive, confidential and proactive environment for people looking to talk about their mental health. And that, look, if you want to find out more about Aware or know a little bit more about what's involved, or you might be interested in volunteering with Aware, or getting access to any of our free programs or our monthly webinar series, our website really is the best place to kind of find information about all those things. So aware.ie, nice and short. You know, and if you're ever concerned about your own mood or the mood of a loved one, our support line is available 7 days a week as well. So information about that on the website, and you can catch us on 1800 80 48 48. Thanks, Margaret, and thanks to everyone here.
Brilliant, Karen, and really appreciate that. And again, anybody who signed up for the webinars, I'll send you out a copy of these, a PDF copy of these slides, so that, and the links are already there, they're embedded in, so you'll be able to follow those at that signposting there that Karen just mentioned. And I'll pass you now to Amy. Same thing, Amy, reflection, or if you want to just let people know what's happening, or yeah, I'll just pass it to you.
Yeah, I would just say, if anyone is curious about Grow or is interested in joining the group, thinks it might be of help to them or someone else, start with our website. We put a lot of work into that over COVID, and there are lots of kind of personal stories there, which is a lovely way to kind of feel the value of peer support, but also podcasts and, you know, pieces of learning as well. It also has all the information of our groups. So as I said, we have 11 in the Mid West region. So if you want to know if there's one near you or a time that suits you, they're there. But we also have our online options as well. And there's over 15 of those. So they run kind of Monday to Friday mix of mornings and evenings. So there probably will be a group that works for you. And just to say that our service is also completely free, open to anyone over 18, no referral needed, similar to what Karen was saying. And, you know, we don't ask people kind of what their diagnosis is or anything like that. It's just kind of come along, and if you think it can be of help to you, great.
That's perfect, Amy. And the overarching thing I'm getting is that person-centered approach being met with kindness and compassion. And I think that goes a long way.
And a cup of tea.
Do you know what? That perfection. That's it. Heaven.
Yeah, that's important.
Kindness, compassion, and a cup of what more could you ask for? Thanks, Amy. I'll just pass you on now, Michelle. Again, same thing. If there's something you want people to know about your service.
I suppose, as I mentioned, kind of there isn't an employment specialist attached to Everyday Hospital yet. Hopefully that kind of keeps rolling out. But it's definitely worth checking in your local day hospital if you are attached to one, if you did want to work with an employment specialist. If not, you can still ask for one because sometimes demand causes things to move. If there isn't, there's also employabilities which employment specialists are attached to. And there's job coaches in employabilities, and they support people with a disability, illness, or injury in returning to the workforce. So the main goal is kind of get people back to work. And they're a really great service if you do need support in kind of how do I even kind of think about going back and what's the steps and what's the support available. So if it's something you're considering, it's definitely worth having a chat with someone who can really guide you and explore the conversations around some of the questions that came up with kind of disclosure to employers and kind of all those kind of other bits that kind of might be a little bit daunting. So yeah, I hope I will keep working away here in Willowdale with clients as we kind of look at kind of going back into employment. And like I mentioned, it's great to be here today and listen to the other innovative projects, and I'm sure they'll keep coming.
And great, and Michelle, keep up that royal we. It's really important.
It makes me feel more important.
Well, what you do is hugely important, hugely important. And thank you for that.
Thank you.
And I'll just pass you there to Mick again. If you just, I know we've mentioned suicide prevention a lot, so just yeah.
Thanks, Margaret, again. And I've just quickly responded to some of the queries that have come through the question and answer forum. I'm a really slow typer, so apologies. I'd prefer if people were able to give me a call on that number, and I'll try and answer some of the questions. Some of the questions are some of the responses that I would want to give are going to take a little bit of discussing with people, but there've been questions in relation to training, but also sort of the strategy itself, and how do we evaluate the strategy, and how do we know it's working, you know. And they're sort of really important questions, a really good question, and if people want to call me on them, I'll try and answer them by having a conversation with them, if that's possible. But again, thanks very much for the opportunity to be here today, and it's great to meet you all, the members of the panel, and great to see that work like this is happening.
Thanks, Mick, and thanks for taking the time just to answer people there in the Q&A, and for offering them, you know, to get in touch with yourselves. I know it's so hard because when we do these, questions come out and we really can't give it the time and the just that it needs. This is a whistle-stop tour, but it's just to give people a taster of what's out there and give you, you know, that moment to kind of put your case out there. This is what we do. This is how we do it. This is why we do it, and this is how you can contact us. So I hope that it's met, you know, people's expectations, those attendees. And I suppose, Mike, I'm just going to say, you know, if you want to just say a few words, because again, we're 2 minutes past. We're a bit fouled now, but we need to close it down.
I know, but I'll say, I'm going to echo what Karen said earlier. Ask. It's like our tagline here. What happens when you ask people? Because if you don't get it with Aries, you don't get it with, keep asking. But you'll eventually get there, and you know, whatever you're looking for will be there. And as I said, also I said, go back and look at the previous YouTube part 1. We didn't know this was going to take legs, you know. But again, we could already fill a panel again with different people for the next time. So again, great stuff. Great to learn about what's going on out there, and I'm sure people will have gained the same knowledge that we have done as well. Take care. Thanks, Margaret.
That's great. And yeah, just again, you've got our details there in terms of finding us online, both Mike, myself, and the wellness panel is there as well. You can find us on Spotify. Just need to make a quick mention. Claire was already mentioned. Amy mentioned Claire Flynn in terms of the menopause cafes. Claire does great work there as a development officer at Mental Health Ireland in this region, and her contact details are there. Again, you'll get a copy of these slides anyway in the learner pack. Anybody who signed up and have left their email address, will send a copy out. Thank you for staying with us. We're 4 minutes over, but I hope it was worth it. And I just want to give my sincerest thanks in particular to the panelists, because it's not easy coming on and, you know, trying to be succinct, and you've done an amazing job. And I just want to say thanks for sharing all that information with us, and a big thank you to our participants. Thanks for sticking with us, and for asking really interesting and probing questions. Yeah, really appreciate it. So with that in mind, we'll just say our goodbyes. Goodbye, Karen. If you want to open your mics and all say goodbye, we will then close down the webinar.
Yeah.
Thanks,
Bye,
everyone. Goodbye.
Thanks a million.
Bye.
Yeah.
I know, and thanks a lot.
See ya.
Bye now. See you again. Don't forget to check us out our webinar next month. We'll be looking at sleep.